Minister.
Thank you very much indeed, Mr. Deputy Speaker. And I would like to thank everyone who's taken part in what I think has been, with one or two exceptions, a generally constructive debate. And I just want to start, if I may, with the contribution made by the Honourable Lady Erethan Thamesmead just now. She said, rightly, that politics is about choices. But what choice have Labour given the people of this country? Have they given the people of this country a healthcare plan or a social care plan? Have they given the people of this country any indication of what taxes they would raise? Again and again, they have been asked by members, actually not just on this House, but elsewhere in this House, what taxes they would rise, what their plan is, and there is no plan. And I felt particularly badly for the Honourable Lady, because the member for Hornsey, I've got the 27 speakers, so if I may, I'm going to continue for a while. I may take an intervention later on when we've made a bit more progress. But I felt very badly for the Honourable Lady opposite when the Honourable Lady for Hornsey and Wood Green asked what Labour's plan said. Well, we'll talk, the shadow front bench will be addressing that in their remarks. And with bated breath, we waited for that moment when the shadow front bench would address the question as to what the plan was or what the taxes were to fund it. And I can tell you, Mr. Deputy Speaker, it's going to need a lot more than £12 billion of health and social care funding in order to repair the damage from that hospital pass from the Honourable Lady. I'm happy to give her the room.
I'm very grateful that the Minister has given way, seeing he mentioned myself and my constituency. The UK economy has seen enormous asset price bubbles, and yet there doesn't appear to be much money that is getting back from those who have made quite a lot of money over the years through real estate. So could I ask him what he thinks, why he thinks he is taking more money from working people instead of those who have gained enormous amounts, millions, from the asset bubble?
Well, I was desperately sad there, Mr. Speaker. I actually thought the Honourable Lady was going to make a contribution to answer the questions I'd raised about the plan or about the taxation for it. But in fact, let me respond to what she said. Of course, we would expect people who are earning that income to pay it in the proper way through property and income taxes, and if they are paying dividends, their tax will go up as a result of, if they're receiving dividends, their tax will go up as a result of the changes that we have made. On what basis, she asked, do I say that? I can tell you, I answer that on the basis of a distributional analysis that has been published of the overall package of measures by the Treasury over the last week, and that is available for all members to read and consult. And if they do, they will see that this is a very, very redistributive package. So the highest 20% of income households, 20% of highest income households will contribute 40 times the amount of the poorest 20% of households. That is a genuinely progressive policy, and the distribution analysis makes that clear. Let me, if I may, of course, I'm happy to take it.
I thank the Minister for giving way, and I don't think he will mind me saying that he served in this House slightly longer than I have. Has he ever known a situation in his time in the House where the Labour Party, a supposed party of the NHS, has voted against billions of pounds of investment into the NHS?
I think it is actually a desperate shame that they have decided to take this very party political position, because this, above all, is an area where we would expect them to come in behind policy priorities that have existed in the Labour Party for many a long year. May I remind the House that these measures are more progressive than the Nix rise of 2003, for which they enthusiastically voted. And yet they are not supporting these measures. I find it absolutely extraordinary. Let me, if I may, continue. And the Honourable Lady from a seated position asked where my plan is. The answer is it's written down, it's called, and let me just find the exact name for it. I think she should know it. She should know it perfectly happily. I can read her the name. It's called Build Back Better, Our Plan for Health and Social Care. That is a plan. The void that exists on the opposite side of the House is not just a void of a plan, it's a void of a tax package to pay for it. Let me, if I may, proceed. Our colleagues across the House have made the right and proper suggestion and claim and have implored the government to look carefully at how the funding that we're raising can be properly and appropriately spent. And that's absolutely right. No Conservative wants to raise taxes, and indeed no Conservative would like to waste money, and we must be very careful that that happens. I want the honourable colleagues across the House to understand that we take that on board very much on the front bench, and as colleagues will know, we have a health and social care plan that is coming forward in the form of a white paper, and of course there's existing legislation in place to put it on the statute book. So that is the position, but I hear the comments that have been made by my colleagues, and rightly so. The member for North Norfolk raised the point about younger people and the support for care workers. He was absolutely right. It was a point made by the Honourable Lady for Liverpool Riverside. And, of course, we have not just the plan for jobs already published, we also have £500 million new pounds that have been pledged to support social care workers, including through new qualifications, through progression, through well-being and mental health support. That's a very important part of what we are doing at the moment. If I may just proceed, there was in fact one member of the opposition benches who does in fact have genuine ideas for taxation that would support social care. That was the honourable member for Barking. Now, she actually presented a whole raft of ideas. I don't actually accept the ideas that she put forward for different reasons. I think the proposal that the government's put forward is superior as a single, broad-based package of measures that has this progressive distributional effect. But she came forward with ideas. What a void, what an emptiness, what a vacuity sat around her from the Labour front bench and from the rest of her party. And I congratulate her for doing that, because at least she tried to answer the question put by the honourable lady opposite, which is that politics is a choice, involves choices, and what was the choice? And she gave us one. Now, let me just say one other thing. In doing so, however, I think she erred. There's been some discussion about the tax impact and information note that the Treasury put out last week. Let us be perfectly clear. That is a technical document that relates only to this levy. It does not relate to the overall effect of the package of measures that it funds. And that overall effect we expect to be broadly, macroeconomically, we expect that to be broadly economically neutral. And that is the picture that we are presenting. So just to look at the tax side, as the Honourable Levy did, is, I'm afraid, to miss half the point of it. And the point was made very well by Ben Broadbent, a member of the Monetary Policy Committee of the Bank of England, where he said, and I quote, "We do not expect..." He said, one should not ignore one half of that policy announcement as far as the effects on the economy are concerned. And he was absolutely right about that. So what we have is a balanced policy. We have a health and social care plan with a funding package that the House is considering at the moment. Let me proceed to talk a little bit more about colleagues. I very much support the comments of my friend, the member for Hemel Hempstead, where he talked about the concern that other members across this House have about the increase in pay at hospital trusts and in some parts of the NHS. That is a matter for concern, and we have to be absolutely clear that that money is being properly spent in the NHS and across hospital trusts, and it's a very strong concern of my friend, the Right Honourable Member, the Chief Secretary, because he, like us, like I, is concerned to support not just our NHS, but also the taxpayer in making sure that that money is properly spent. I very much supported the points made by the member for Arundel and South Downs, where he celebrated the adult social care workforce. He was absolutely right to do that. I hope he will be pleased at the £500 million that we've mentioned there. May I remind the House that in grasping this nettle, the government has not just moved forward on an issue that has been outstanding in front of this House for many years. It is specifically showing how inadequate the Labour Party response was to their own Royal Commission of 1999, from which virtually, as we can see, no enduring social care package followed. If you don't like that, Mr. Deputy Speaker, let me direct you to the Wandis report of 2006, on the basis of which no sustainable social care package was developed. That situation is changing now. This government is putting that sustainable social care funding in place. It is doing it with a levy that tracks many other countries which have social care levies in place. This is a progressive and a long-term way to address a problem that has remained in front of us but unaddressed for far too long, and I commend this measure to the House.